The following outlines our mission statement for today. It's also going to be an open letter to Boris Johnson, Liz Truss and Dominic Raab. Starting tomorrow, this letter will be shared online for you to sign before we send it. So please do go over to our social media to sign and share this letter. I apologise, this is going to be a bit long before we get onto the far more entertaining speakers. So on the 16th of May 2021, the government made an announcement headed by the Minister for Women Equalities Liz Truss, alongside Foreign Secretary Dominic Raab, that the UK were due to host a global event between the 29th of June and the 1st of July 2022, inviting countries around the world to discuss the UK's work on LGBTQ+ rights and what the UK could teach other nations going forward. The event was later cancelled due to backlash from the community and an overwhelming of UK LGBTQ+ organisations. This was because of attacks on the community, which included an unwillingness to implement a comprehensive conversion therapy ban that included protections for the trans community, strife with exploitable loopholes, and a negative and violent anti-trans and overall anti-LGBTQ+ environment that is being fostered by senior government officials. The UK government has failed to deliver on key promises, which include implementing the aforementioned ban, their promised substantial reform to the Gender Recognition Act, and the failure to make moves towards the depathologizing of LGBTQ+ and trans medical care. This, however, is not the only failing committed by the UK government. Minorities from across the UK have been impacted by an unsafe environment cultivated by our elected officials. From Muslims being attacked by our own Prime Minister with immature bigotry such as calling Muslim women letterboxes, to black people being disproportionately targeted by the police under a government that claims not to be systematically racist, to migrants who have escaped harrowing situations being deported to Rwanda, where their lives are at risk, and the stark rise of anti-Semitism here in the UK, with the highest number of hate incidents reported in the last year. Shame. I'm going to further outline in what ways it is not safe to be yourself in the UK for many minorities, and how current and past affairs have impacted people in their lives. In response to the UK's proposed SafeToBeMe conference, we are protesting and letting the UK government know it is not safe to be me. LGBTQ+ rights in the UK have been negatively impacted by the rise of hate being perpetuated by the mainstream media, UK government officials, and anti-LGBTQ+ organisations, and other marginalised communities have faced a similar impact, many of whom intersect multiple identities and minority groups. While this protest was organised by a group of trans activists, we recognise that the trans community is far from the only community for whom the UK is currently unsafe, and we want to make it clear that intersectionality and standing alongside other minority groups facing hate, harassment and legal fights is vital if we are going to improve the state of inequality in the UK. Hate is not experienced in a bubble. Black and brown queer people face hate and barriers not experienced by many in the LGBTQ+ community. Autistic trans people face unique barriers to healthcare access. Disabled sex workers face unique barriers in accessing support they should be entitled to. So many minority groups and intersectional groups here in the UK are facing their own unique struggles and deserve to be heard and to feel safe in the UK. The UK needs to reckon with the fact that many of its institutions enact discriminatory practices that harm many of our most vulnerable community members, particularly those from intersectional backgrounds. Police often use unnecessary violence, over-policing and undue suspicion against BIPOC members of the community, particularly black men, as ways to criminalise peaceful existence through bigoted generalisations. They also often treat neurodivergent people as inherently suspicious due to basing their system of assessing guilt based on neurotypical behaviours, and will treat harmless, self-regulatory behaviours as inherently dangerous. Many minority groups in the UK are assumed guilty rather than innocent as a starting position, and as such they perpetuate the same bigoted beliefs they initially acted on. However, the police are far from the only UK institution that has issues with discriminatory practices baked into their day-to-day operation. Black women in the UK regularly have their pain ignored by doctors, who will deprioritise taking black women's reported symptoms as seriously compared to white patients with the same issue on paper. The Gender Clinic Service in the UK discriminates against neurodiverse trans people, assuming, for example, that autistic people, like myself, are less capable of understanding and consenting to transition, or that people with ADHD might just be experiencing a period of low impulse control, and using that as a barrier to delay access to a care system that already features huge multiple-year waiting lists for care. From assumptions that disabled people are faking their disabilities, to structures set up to deny various communities in the UK upward mobility, the UK needs to confront the fact that multiple minority groups face structural discrimination from services that we are meant to be able to rely on in an emergency. This discriminatory behaviour is further evidenced by the handling of reporting on minority lives by the UK press. The press is routinely complicit in perpetuating harmful misinformation, often to the detriment of minority groups and those most vulnerable in society, with minimal oversight, regulation or accountability. From the UK media's regular spotlighting of anti-mask and anti-vaccine rhetoric during a global pandemic, leading to a less safe society for the immunocompromised, to the BBC stating that they would platform flat earth views if they became a popular belief as a justification for their platform of anti-trans hate groups. This has been an ongoing issue in the UK for decades, with no signs of stopping, despite evidence of the harm that it causes. Whether we're looking at the fear-mongering regurgitated in the 90s by newspapers implying that vaccines were potentially linked to the development of autism, to the 2000s media fear-mongering of migrant communities, the UK press routinely highlights perspectives that they know are incorrect for personal gain and uses minority groups as a rotating cast of villains on whom to blame society's ills, and this cycle cannot continue. We hardly need to mention the similarities in today's transphobic reporting that shockingly mirrors the demonisation of the gay community in the 80s, with AIDS fear-mongering and the painting of queer men as predatory child abusers. Gypsy, Roma and Traveller communities are protected under the category of race in the Equality Act 2010. However, they have been routinely treated as second-class citizens by a government that has done little to stem the UK's history of discrimination towards GRT citizens. The Conservatives' Police Crime Sentences in Courts Bill directly enables lawful harassment and discrimination of a protected group, endangering their homes and their safety. Though it is technically legal to be a sex worker in the UK, legal protections and general protections for this vulnerable group are basically non-existent, with the UK not allowing sex workers to work together to build a safe environment, forcing sex workers into isolation. They also face police brutality and discrimination, with police regularly raiding homes and harming a vulnerable group with arrests for self-regulating their safety. Sex worker discrimination goes deeper than government and police discrimination, with discrimination coming from crucial societal establishments such as banks and financial systems, schools, digital discrimination and deplatforming, and of course, societal stigmatizations. The UK routinely misuses statistics and unfounded surveys and data from hate groups to deny issues affecting minorities. This can be seen when the government officials, such as the former Health Secretary, misused COVID data during a global pandemic, to the fear-mongering using fictitious or biased data to stir up anti-migrant sentiment. Another example is the BBC using a statistically flawed survey from a known anti-trans group, which was neither quantitative nor qualitative. The government has lied about the NHS using incorrect statistics, a service which the majority of people in the UK rely on. The truth is that the current state of healthcare impacts vulnerable minorities, causing suffering amongst our communities and even deaths, either from lack of healthcare, suicides, long wait times because of long wait times, or government negligence. The UK has progressively over the past few decades increased the complexity of barriers standing between disabled people and their access to healthcare and financial support needed to survive. From the gutting of funding for NHS services, to the Department for UK Work and Pensions pushing out ever more strict and discriminatory requirements preventing access to support services. Disabled people in the UK are increasingly spending their lives on lengthy waiting lists, precariously close at any time to having their only source of income pulled with little recourse. Disabled people in this country cannot marry without risk of losing that income because of their partner's income and have their lives turned into constant paperwork battles just to receive basic support, and this needs to change. We've known since the start of the pandemic that COVID inequality has impacted BIPOC people and communities disproportionately in the UK. This should not be a surprise, as historically the UK has a long-standing history of worse healthcare outcomes for BIPOC communities. BIPOC communities are disproportionately working jobs in the UK which could not be done remotely, receiving higher rates of scepticism and worse care in hospitals, and were not given adequate consideration in the government's approach to opening up the country post-pandemic, which is not a thing. From discrimination persisting within the NHS to a lack of proper financial support for those who needed to miss work after a positive COVID test result, proper steps were not taken to ensure that BIPOC communities were protected from receiving unequal health outcomes during a national health emergency. Bisexual, pansexual and M-spec individuals are also subjected to difficulties accessing healthcare, with many people reporting that healthcare professionals do not understand their specific health needs and that they face inappropriate curiosity during medical appointments. The lack of education and visibility of issues that M-spec people face means that the discrimination that they experience is often overlooked both inside and outside of queer communities. A big topic of conversation in the UK right now is the ban on conversion therapy. The ban fails to be truly effective and inclusive due to only covering a limited selection of queer folks and containing easy to manipulate loopholes. However, a matter that is not widely discussed is the lack of protection for asexual people who are at great risk of domestic as well as religious conversion practices and even corrective rape. The UK has downplayed the harm inflicted on intersex people, with the House of Commons claiming in 2016 that intersex medical interventions were a thing of the past, and denying to the UN that same year that we even had such practices for intersex children. This is an outright fabrication, as proven by intersex organisations and even the NHS, who in the same year provided statistics that resulted in the UN committee expressing concern at medically unnecessary surgeries and other procedures on intersex children before they were able to provide their informed consent, which often entails irreversible consequences and can cause severe physical and psychological suffering, and the lack of redress and compensation in such cases. The next year, the UN called on the UK to abolish all legislation and practices that would allow any form of forced interventional surgery. 5 years later, and the UK still hasn't done this. In 2015, intersex status was specifically included in the protected characteristics of sex in Jersey to protect intersex people from discrimination. The UK has not followed suit. Several countries in Europe allow intersex people to change their sex marker on identification documents on a basis of self-identification. The UK does not. To summarise, it is not safe to be me. It is not safe for many communities and people in the UK to not only exist, but also to thrive, for more reasons than we can possibly list, and we've listed a lot. The UK, its institutions, its mainstream media and its government have been continually failing the people it has sworn to serve. Recently, the government announced amendments to the Human Rights Act, a vital piece of legislation protecting our rights. This serious attempt at removing the protections the Human Rights Act provides will set a dangerous precedent and will be used to discriminate against the UK populace. Further evidence that it is not safe in the UK is several reports and equality indexes published in recent years that show the UK is drastically regressing in its protections and provisions for the safety of its citizens, with this hostile environment primarily impacting minority groups. Reports show the highest ever recorded anti-Jewish hate in 2021 for London, with a rise of 37% from the previous year. UK bodies who monitor racism in the UK reported that race and nationality-based hate crimes rose by 73% in 2021, with a 12% rise in racially aggravated offences recorded. Further damning evidence for the UK, while the government declares that it is safe in the UK for people to be themselves, is the ILGA Europe's Rainbow Map and Index 2022 publication that reports the UK was the country with the most dramatic drop in the index, losing 11% of its points and falling from 10th to 14th place in a year, which marks our third year running of a decrease in points. In highlighting all of this, we hope that this statement and this protest urges UK bodies, the media, government officials and individuals in the UK populace to re-evaluate their positions and do more to protect those most vulnerable in our society, to ensure we are moving towards an equal society rather than falling behind, to combat the rise in hate and violence in the UK, and to make sure it is genuinely safe to be me in the UK. Have a drink. So, it's a protest. And a protest means we have demands. 1. The UK needs to challenge discrimination of all forms, including race discrimination, gender inequality, sex worker discrimination, religious minority discrimination, and discrimination against disabled people. Addressing inequalities and taking steps to reducing inequality through working with reputable, non-hateful organisations. 2. The UK as a whole, including the government, media organisations, the education sector, etc., need to publicly recognise the harm that has been done to LGBTQ+ rights through their anti-LGBTQ+ rhetoric. They must recognise that this has caused a spike in hate and violence towards queer people. 3. Recognise the harm that has been caused to other minority groups and publicly acknowledge that it is not safe in the UK for minorities with the rise of hate and intolerance. 4. To stop attacking crucial LGBTQ+ organisations such as Stonewall, which has been paramount in securing fundamental rights for people in the UK and abroad. Fuck yeah! As well as removing support to hate groups such as the LGB Alliance, whose official charity status is an insult to the Charity Commission. Fuck the LGB Alliance. 5. To recognise the systematic and institutionalised racism prevalent in the UK and stop denying the fact that the UK is failing to adequately tackle racism rather than boasting the opposite, with protections of minority ethnicities which is sorely lacking in practice. 6. Listen to the LGBTQ+ community and not rely on fringe organisations whose primary goal is the eradication of trans people, who seek to deny LGBTQ+ people rights that are fundamental to living freely in society. 7. Address the significant barriers that LGBTQ+ people continue to face, address the power imbalance that we face currently in society, and shut down all of those who foster hate and intolerance, ensuring that queer people feel safe in their everyday lives and are treated with respect and dignity. 8. Ensure healthcare is accessible to all LGBTQ+ people without stigmatisation and medicalisation by providing a balanced and fair health service that does not pathologise queer sexualities and identities. 9. The UK to accept the harm it has caused to intersex people and enact intersex protections as per UN requests to guarantee bodily integrity, autonomy and self-determination to intersex children, abolishing experimental medical procedures, forced intervention and surgeries on unconsenting minors, and ensuring that intersex people are legally protected from discrimination and given the freedom to self-identify with identification documents to match. 10. Cover LGBTQ+ communities, sexuality and identities in schools and education as part of the curriculum. 11. Cover critical race theory in schools and education as part of the curriculum. 12. To enact and protect the right to bodily autonomy for every person within the UK. This includes, but is not limited to, the right to self-identify as any gender, genders, or lack thereof that best matches you with the legal protection and documentation to match. The right to gender transition healthcare via local surgeries adequately trained to administer it, to abolish outdated gender clinic waiting times. A full conversion practices ban that covers the entire LGBTQIA+ umbrella. The freedom to dress without the restrictions of gender conformity. Respecting a woman's decision to wear religious garments, even if ignorant Western views misinterpret them as oppressive. I'd also really like a big cheer for this one. The full decriminalisation of sex work. Using inclusive and accurate medical terminology in all areas of healthcare to ensure that all people feel safe accessing medical care, including men and non-binary people with uteruses who decide to give birth. And then the last one is incredibly appropriate and relevant right now. Allowing all people with uteruses full legal access to abortions without question. Without having to first meet a narrow set of criteria, without allowing doctors the ability to refuse them based purely on personal biases. This isn't in there, but I'm adding, a lot of people think that abortion is an easily accessible right in the UK. It is not. Doctors have the ability to stop women and trans people from having abortions. Roe versus Wade is setting a precedent that is going to cover the entire world, essentially. It's a start there, and a lot of people say that it starts with trans people. It doesn't. It always starts with women and spreads to everyone else. We're just an example to show that women can be oppressed, and it's going to keep getting worse. Abortions need to be an easily accessible legal right. And that's me shutting up now, so I'm going to pass you over. Thank you very much for listening.
Thank you so much, Felix. That was a lot.